So we're here today. We have really arranged for a very, very innovative group of speakers that are going to be presenting to you all. And really, to kick off the track, I have Andrew Chung from Khosla Ventures. Andrew is partner at Khosla Ventures, and his primary focus and area of interest is food, agriculture, ventures, healthcare, and consumer-based focused industries. His primary investment strategies are focused on China, and I think he just came back a couple of days ago from China and is here to kick off our session for you guys. So with that, I would like to invite Andrew. Andrew?
Good morning, everyone. How was the keynote this morning? So everyone has their own TiEcon story, and for me, I have one as well. Actually, I used to be involved with the energy track many, many years ago, and 7 years ago at TiEcon, I actually met Vinod Khosla, which actually was, of course, a pivotal meeting that ended up changing the course of my life, and certainly I hope that the many connections that you folks make here will similarly change your lives for the better as well. I was asked to spend a few minutes talking a bit about how we think healthcare will be disrupted with technology at Khosla Ventures. And so I'll just spend a little bit of time talking about some of the interesting trends that we're seeing that are coming together to create a perfect storm around healthcare, talk about some of the different areas of investment interest, and then maybe touch on a quick case study or two before passing it off to some of the other speakers that will illuminate you further about what's going on in healthcare IT. So at Khosla, we've been tracking a number of different trends very carefully over the last several years in multiple disciplines that all work together to create an interesting point of disruption for healthcare. The first is that mobile devices, of course, now are ubiquitous and are empowering consumers with the knowledge of being able to track information about themselves, being able to log and monitor different things about themselves, and potentially guide treatment. So that's one of the themes that we'll talk about in a moment. The second is that data science has reached a stage where all of a sudden the mobile device that we just talked about has the supercomputing capability coupled with data science algorithms that really can analyze a significant amount of information about one's health, well-being, and be able to recommend treatment and actually get to the point of potentially replacing a doctor with a lot of the more basic types of treatment. Ubiquitous sensors. This is another area of development that has really made some significant strides in the last several years. The types of sensors that are available today to be able to monitor every aspect of what's going on in different parts of your body is very interesting. And then last but not least, and perhaps a bit different from some of the other things that I've mentioned, is the state of biology today and the genomics field has advanced to an incredible level that is poised to dramatically change how doctors even look at the way to diagnose different types of diseases. Only a few short years ago, it cost hundreds of thousands or even $1 million or more to be able to sequence one's genome. And this year, we broke that vaunted $1,000 per genome barrier, which is poised to really shake things up in terms of how one thinks about diagnosing disease. Next slide. So with all of that, the different trends are all working together to really turn what has traditionally been medicine as an art into medicine as a science. If you really think about the way that your patient-doctor interaction has happened over the last 20, 30 years, it hasn't changed very much. The way that we interact with them is similar to the way that 100 years ago a doctor might have interacted with a patient. And the types of technology advancements that have been traditionally stuck at the doctor's office now are slowly getting to a point where they can empower consumers to take matters into their own hands and, again, turn medicine from what is an art where a doctor will diagnose something based on very limited information to much more into a science where we can get to a very specific, defensible analysis of what's going on in your body and the different ways to try to solve it. So here on this slide, I have 6 different areas that we have been looking at. And luckily, over the last several years, and somewhat quietly, we've been building up a portfolio around some of these solutions. So the disclosure is that each one of these companies listed on the slide is a Khosla investment. On the left side, you have a lot of the things that will empower the consumer, again, to take diagnosis into their own hands. And that can range from things that are more consumer-oriented, like wearables, to things where you're more of a patient, where we are actually trying to prescribe a diagnosis or trying to solve a problem that currently only a doctor can do. On the top left corner, you have mobile diagnostics. So companies like AliveCor, which I'll talk about a bit more in a moment, or CellScope, you're actually using your cell phone as a peripheral to diagnose disease. AliveCor is giving you the ability to analyze your ECG or your electrocardiogram and monitor your heart using your iPhone. CellScope is allowing you to do what is now the most common reason for going to a pediatric office, which is an inner ear infection. You can use your iPhone to scan inside the ear and go into the cloud and look at a database of over 1 million different images of what different ears look like, and use the iPhone to do the pattern matching to tell you whether you have an inner ear infection or not, and whether you should waste the time to schedule an appointment with a doctor and finally go get some prescribed medicine. The middle one is quantified health and fitness. So this gets a bit more into the consumer angle of things, where it's really about enabling you, the consumer, to be able to track different pieces of information about yourself. So companies like Jawbone, Qantas, and Misfit are all about devices that either are more functionally things that you want to have. So the Jawbone Up, of course, is a wristband that's tracking things like your heart rate, skin conductance, and a couple of other things to be able to track your health over time. Qantas is actually working on some pretty stealthy things that will take the level of measurement to yet another level. But similarly, it's about having a stylish or a way of having something on your body at all times that is monitoring your health and then potentially providing you data that can improve your diet, your wellness, and your fitness. On the bottom left, we have some advanced sensor technology that takes the first two buckets that I just mentioned and takes it to yet a different level, being able to achieve some holy grail types of measurement that up till now in history have not been possible. For example, Ziomed is working on a non-invasive glucose monitoring technique to address the diabetic community that is ever growing. It's the largest problem in the US today. And being able to avoid the needle prick that many diabetics and also pre-diabetics have to deal with every day. And in some cases, if you're familiar with folks who have diabetes, they might have to prick themselves 3, 4, 5 times a day, which leads to non-adherence. Many folks don't decide to monitor their health in the right way, or it's a very painful and not clean process. And so being able to solve this holy grail problem of being able to do this non-invasively is one of the big questions in healthcare. And if we're able to solve it with a company like this, we believe that it will radically transform diabetes. Adamant is another very early stage technologies that's working on different ways to detect VOCs in breath to analyze whether or not there's patterns between different breath patterns and disease and other issues in health. And so you can imagine a future where with the things on the left-hand side, you're able to use your iPhone as your doctor and being able to analyze and diagnose a lot of the basic reasons why you go to a doctor. You have other devices that you're wearing all the time that are just non-invasively monitoring what's going on with your health so that those who are active or more concerned about their fitness can track it. And then we've got some next generation holy grail type technologies that we've got in the pipe as well that hopefully can transform even the way that doctors today are able to diagnose disease. On the top right, this is a bit more about healthcare access. We're thinking about different ways to allow individuals to be able to access healthcare better, more efficiently. I just alluded to that issue with my 17-month-old. The amount of time that it took for me to be able to get an appointment with an ophthalmologist, pediatric ophthalmologist, was just ridiculous. And so ZocDoc is now the world's largest marketplace to be able to enable consumers to schedule appointments with specialties and doctors that makes it much more efficient. It's sort of open table for doctors at a very basic level, but then it also saves a significant amount of time because we have taken over now the patient-doctor interaction on the initial side. Before you actually see the doctor, all the different interactions ZocDoc now is able to do. And so we have the largest network now of doctors on that system. HealthTap we'll talk about in a quick moment, but that's also a way of empowering any individual to have access to as much health-related information in an organized way as possible. Another area that's really important to many of you is the advances in AI and machine learning around how you triage different problems. So a medical student is going through 4 years of medical school to be able to essentially understand the taxonomy of all of the different situations that one can be in, all the different maladies and the different ways of doing treatment. It's essentially a very complicated decision tree that takes 4 years and a lot of clinical training to be able to learn for the part of a doctor. Now the question is whether a computer can learn it, and whether IBM Watson and the folks that are working on some of the medically related AI there, or a startup can actually grasp this taxonomy and figure out different ways to be able to help diagnose disease without the aid of a human being. And so we have several companies that are working on that type of thing, Chiron being one of the more interesting stealth ones that we have in our portfolio, to really tackle that problem of how do you diagnose disease without a human being, and can you master that taxonomy and actually get better than a human being, because by storing all of the data in the cloud, you can be able to associate every single patient, the diagnosis that you give, and actually what ends up happening in terms of outcomes. And so being able to track all of that data and helping patients that way. And then on the bottom right, you have this whole genomics area that, of course, as we've talked about, is poised for revolution. Anytime that you have any industry where the cost of treatment or the cost of a test is going down by an order of magnitude every year and a half, you know that there's something that's going to happen there. I mean, this is Moore's law on steroids, and this is happening in the genomics field. And so one of the areas that we've invested in is the area of cancer treatment, which today is in such need for better technology, because the way that one treats cancer is still very similar to the way it was 10 years ago or 15 years ago, and it hasn't gotten the benefits of all the great technology advances that we've had today. So being able to do what Guardant Health is trying to do, which is essentially being able to do genomic analysis of tumors without a biopsy, can potentially have tremendous implications for how a cancer patient can get diagnosed and the types of treatment that can have along the way for such a terrible disease. Next slide. So let me talk very quickly about two different case studies, and then I'll pass it off to the next speaker, who has much more to share about all of these exciting trends that are happening. AliveCor is a company that has a very important and personal emotion for me as well, because my father has a heart condition, and about 10 years ago actually came very close to having a heart attack and needing surgery. And at the time, and as it is today, he goes to the cardiologist, the best one in New York City, once every quarter, where I hope, as his dutiful son, that in that 5-minute encounter when all of those leads are on his heart, that in that 5 minutes, whatever is wrong with his heart better show up at that moment. Because if it doesn't show up at that time, then we have to wait another 3 months before I can check on him and diagnose him again. And so that piece of equipment that's critical to doing that is a $10,000 piece of equipment that's in a cardiology office, it's in hospitals, and it's often in the back of an emergency vehicle. We have a team, introduced by our next speaker, by the way, Dan Kraft, who has been able to distill that $10,000 piece of equipment into an iPhone case and reduce the cost to about $100, which is essentially free. So when you have a 2 order of magnitude change on that, of cost on that type of product, now I can give one of these to my father after dinner every day. He can sit at the dinner table with his hands on the iPhone, and we can get an ECG to analyze whether or not there are some issues there. And so using the computing power of the iPhone, coupled with all of the ECG patterns that we have in the cloud, we're able to give a much better diagnosis as to whether my dad should just sit and hold, wait for the next cardiology visit, should he go to the hospital right now, or he is having a heart attack right now. Andrew Chung will now get a text saying that we have to call 911 to make sure that he can get treated. So it completely moves this from the control being in the hands of the cardiologist to empowering a consumer to be able to take control of his or her health and be able to prevent a heart attack or this type of condition. And this is a great example of some of the other types of companies that we've invested in this area. Next slide. The last one that I'll mention is HealthTap, which is another company that we've invested in at Khosla that is around actually creating an online doctor for you. This is about connecting patients with the best health information out there and the best doctors out there. Over a several-year period, this team has been able to answer 1.3 billion questions about different health problems. For those of you who have been on her WebMD or a number of other websites, or when you Google to see, hey, my daughter just had projectile vomit. What do I do? I'm a first-time parent. I have no idea what to do. You go to Google and you type that in, and you get all kinds of weird answers. And when you go to WebMD and you actually check off all the different symptoms that you see, you get things from, oh, it's a virus, to a bacterial infection, to some sort of gastrointestinal cancer. It's completely irrelevant, not helpful. And so what HealthTap is doing is, by aggregating 50,000 doctors who actually on their off time enjoy answering questions about different issues, you're getting multiple answers from doctors to a question that you normally would ask and answer in the health visit. So instead of me calling my health provider, trying to schedule an appointment today, tomorrow, or Thursday, and then waiting, taking time off, bringing my child there, waiting for an hour before the doctor comes in for 5 minutes to ask a routine question, now I can do it online. And I can benefit from the 1.3 billion answers that have already been answered, so that I can make my own judgment as to whether I want to go to the doctor and waste that time or not. And you can imagine that for something like this, now that we have the largest network of doctors, people are now concerned about their reputation. They have a virtual practice. And so doctors now have an interesting channel to be able to build a platform to be able to diagnose more complicated things. And that's one of the things that HealthTap is trying to become, which is essentially the online doctor that so far has been elusive to all of the different startups that have tried to do it to date. And all of this is about empowering consumers to be able to get health information when they need it, as quickly as possible, so that they can avoid that visit and save the visits for the things that are really complicated or really damaging. So with that, I'd like to tell you, for one thing, that as an investor, I'm incredibly optimistic about what's going to happen in the next 5 to 10 years. There's going to be a wave of transformation thanks to a lot of the different trends that we've talked about. There are a number of startups out there today that are working on different ways to disrupt the healthcare field. So with that, thank you very much.